State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. We begin with an update on the coronavirus crisis in Maryland. Currently, about 1,400 Marylanders hospitalized with the disease. About 40 deaths are being reported per day on average. Nearly half of the deaths involve African Americans, who make up just about 30% of residents. The hint of good news is that the rate of increase may be slowing, and that has led Governor Hogan to start making plans to relax the state shutdown.
It will continue to be important for Marylanders, particularly older and more vulnerable Marylanders, to continue to stay home as much as they can. And all Marylanders should continue to avoid crowds and gatherings, and they should continue to practice physical distancing and to take precautions to protect themselves, their families, and their fellow Marylanders.
Joining us now, Maryland Comptroller Peter Franchot. Sir, thank you for being with us.
Jeff, it's a pleasure. My best to your viewers or listeners.
And likewise, best to you and your family and your team at the Comptroller's office. How's everybody doing?
Well, we're all working from home except for some essential employees, and we've declared a tax holiday, so all tax returns and tax payments to us from businesses and individuals is deferred now until July 15th. People are appreciative of that because that's, billions of dollars in cash that immediately and speedily is retained by our Maryland families and small businesses. And that's what they need right now because there's so much uncertainty in the economy.
Now we're speaking today before the governor's announcement about his plan for reopening the state. I know you've been in contact with the governor. Broadly speaking, are you supportive of his plan? Do you think we've been too aggressive, not aggressive enough? What do you want to see going forward?
Well, let me just say, I think Governor Hogan, he's a Republican, I'm a Democrat, but I think he's done a very commendable job in giving us aggressive, honest, unvarnished leadership on how to protect ourselves from a health and safety perspective. I don't know all the details of what he's going to announce today, but I'm generally supportive of his approach, which is health and public safety first. Secondly, the economic reopening of the state. He and I both desperately want to do that. We're both champions of small businesses, which are the backbone of the state's economy. So I assume what he's going to do is say, look, we want to open it smartly and we want to open it carefully. What we don't want to do is go too fast and then risk a total shutdown as a result because the virus gets its hooks into us again. So generally, it's a very positive feeling towards him. And I think that is reflective of what the citizens of the state feel.
I read an interview you gave a local newspaper where you said that you want to see small businesses get a little bit of a head start coming out of the gate when things reopen.
Yes, and I mentioned this yesterday because I think it's important. We have 175,000 small businesses in the state. Most of them are not going to qualify for federal or state relief programs, mostly because they're going to be so congested and it's such a cumbersome process. And many of these small businesses are sole proprietorships. So my suggestion is, since we have health concerns in reopening the state's economy, why don't we allow real mom and pop, family-owned, Main Street small businesses that have 10 or 15 fewer employees that have been particularly hammered by this situation that we're in. Why don't we let them have 2, 3, 4 weeks of head start? Allow them to open, allow them to get some revenues, allow them to get some traffic from consumers, but also measure very carefully, because they're not big stores. We can measure what the public health implications are. But I like the idea of taking our 175,000 small businesses and giving them a leg up.
Did you ever think you would see anything like this? I mean, the economic impact is unimaginable. I read that ridership on the Washington Metro is down 95%. You have tens of millions of people suddenly out of work across the country. So you have the I mean, there's the human suffering from the disease, there's the economic suffering, and then the government's ability to respond to it and help people if we're going to face a budget crunch is also a challenge.
Yeah, no, it's unprecedented times. The state revenues, as you know, have totally collapsed. The sales tax revenues are almost non-existent, and we're going to have to do major reorienting of state spending out of necessity. I do think out of this, we get a chance to reinvent ourselves as a state and be a much more welcoming state to small businesses and families that want to locate here, and not be so perceived negatively by seniors and retirees as a high tax state. I think we can reform some of those things, but no, did I ever think in 2020 that I, as an American, would see the greatest country in the world brought to its knees by this double whammy of the virus and then the shutdown of the economy? It's incomprehensible to me. I regret to report that most of it couldn't have been avoided if we had done what South Korea and some other countries have done, which is, have a game plan as to how to deal with it. Having said that, I don't really care about the blame game. I'm just interested in making sure that we can bring as many of these businesses through this as possible. We're going to lose tens of thousands of them, but we also are going to have a chance to reconstruct our state's economy. It's going to take several years, and I'm looking forward to the challenges that are associated with that. But my heart goes out to the 340,000 newly unemployed, obviously, to all the owners of the small businesses. But I assume, and I will take somewhat of a lead from Governor Hogan as to how we go about intelligently reopening the economy.
You told me before there's a rumor out there concerning small businesses that you want to shoot down.
Yes, unfortunately, there is some social media commentary that somehow the Comptroller's office is holding up or penalizing small businesses applying for grants if they are in arrears as far as their taxes. It turns out that it was something to do with a completely different agency from ours in state government. It has to do with property taxes, not the taxes that we collect. Let me just make it emphatically clear. Every small business should be applying to the state and to the federal government. I will have their back to the nth degree. We wrote the Small Business Administration yesterday saying, please make sure these relief dollars are directed not to the large publicly held companies, but to small mom and pop family businesses. So every small business in the state of Maryland should realize that they are going to suffer no penalty, nothing, if they take us up on our tax holiday I mentioned and don't file their taxes until July 15th. And we are not going to interfere with anybody's grant application. And you know how the social media works. It's out there, and it takes a lot of time to catch up with the lie.
That was Comptroller Peter Franchot. The largest number of cases in Maryland by county is in Prince George's County. Our Charles Robinson looks at the concentration of cases in the African American community there.
Absolutely, we feel it. We feel it, especially pastoring the church in Prince George's County, and you're seeing what not only is our plight, but the plight of other communities who look like us, and you see the kind of numbers that are coming in.
Maryland reports out daily the number of COVID-19 cases. Since it began collecting racial data, more African Americans have tested positive and died from coronavirus in Prince George's County than anywhere else in the state.
The African American community, they have distrust of medical systems because they don't think that they have their best interests at heart. And that's one of the big problems. You've had the Tuskegee experiment and several other experiments and processes that have created what we have today.
The county had one of the first remote testing sites set up at FedEx Field, manned by the National Guard. There is a new hospital being built in Landover, and a former hospital in Laurel is looking to ramp up to address medical shortages. Despite all of these efforts, it doesn't take away the sting of losing a loved one and traditions of honoring their lives.
When we talk about grief, we know that grief is a process, and it's very challenging for African Americans because the way things are now, the traditional way that we know in terms of how to grieving, homegoing services, family, community, getting together, talking, reflecting. Now, all of that's changed due to COVID-19.
How is this new norm affecting you? Right now, it's too fresh, so we don't really know. But as time is going to go along, you're going to start to hear the stories, and I think it's going to peel back to counselors and ministers and persons as you're going to start working and trying to walk persons through this time of the end of life for a person.
In Prince George's County, I'm Charles Robinson for State Circle.
Charles, thank you. We are joined now by Dr. Oliver Brooks, who is president of the National Medical Association, which is based in Maryland. For over a century, it's represented African-American physicians. Dr. Brooks, thank you for your time.
Thank you for having me on your show.
So, sir, your practice is in South Los Angeles. I'm curious what you're seeing in terms of the impact of the coronavirus on the overall community and on the African-American community there.
So in Los Angeles, we are seeing a disproportionate effect on the African-American community. About twice the number of African-Americans are being affected proportionate to our population. Latino community is about at proportion to their community, so that's kind of an interesting finding. Hospitals are not full, they're very busy. I think that has to do with some of the sheltering in place, safer at home that our governor put in place. Actual clinics are a little slower right now because a lot of routine care is being delayed or deferred, and the sicker patients are going straight to the hospital. So in the clinics, it's a bit slower. We're doing a lot of telehealth. Overall, Los Angeles has been affected, but right now we are able to manage those that we have.
What are the factors in this racial disparity? In Maryland, the numbers are African-American community, according to the Census Bureau, is about 31% of the state population. Of the people dying in Maryland with coronavirus, it's about half.
So I would say this is interesting. Disasters or pandemics don't create inequity, they unearth or unmask them or expose. So the way I look at it is there is a toxic admixture. The three factors that are going into this, and they all intimately intertwine. So we have the concept of comorbidities. The African-American, the people of color communities are sicker for a number of reasons, but let's look at it. Diabetes, 2.2 times more likely to occur in the African-American community. Hypertension, 20% more likely. Obesity, 30% more likely. The deaths from and hospitalizations from COVID-19 are directly related to hypertension, diabetes, obesity, moderate to severe asthma. So there we are at higher risk. And number two, social determinants of health. So we see African Americans are twice as likely to be uninsured. African Americans have 1/10 the family net worth of a white family. We work in jobs that are now, interestingly enough, deemed essential. Grocery store workers, food service workers, security, janitorial. So we're out there, we can't clean a building by working from home. So we're exposed. We may take public transportation to work. We may live in housing where there are 6 people in a 2-bedroom home. So you have us at higher risk just for getting the virus then, and then higher risk with the comorbidities or having a bad outcome. And then thirdly, you just can't hide from the concept of race. That is the mixture that goes into the fact that there was a story coming out of Detroit. A man went to the hospital 3 times with symptoms, was refused hospitalization, ended up dying at home, so never got on a ventilator. His wife went to the hospital and said, I have the same symptoms as my husband. They wouldn't test her, they wouldn't evaluate her, but someone else came in and said, I've been sick from sushi that I ate at Grubhub, and took her back in and took care of her. So that's that implicit bias or the racial aspect that seems to be coming together to cause these issues of higher rates of morbidity and mortality.
So what can be done about, a lot of long-term issues in the short term? I mean, what can we do right now? I see you have a mask with you. Obviously, when it comes to an eventual vaccine, testing, treatments, you can make sure or try to make sure that gets to the African-American community, at least in proportion to the numbers. I mean, does that make sense? And what else is there?
It makes perfect sense. So you lead well with the statements in which you make. So testing is really important. Testing and contact tracing. So if I told you right now you had COVID-19, you would be clearly self-isolating yourself from your family. If I say everyone should kind of self-isolate, you should. If you have any symptoms, you do it. So testing makes you more focused, number one. Number two, then you can contact trace. You were around these 6 people. They all need to self-isolate. Self-isolate means you have it or you may have it, keep away from other people. Self-quarantine means that you were exposed. So again, keep away from other people, but slightly different too. So as African Americans, I would say be doubly focused on preventive measures. Wear a mask when you go out in public. Wash your hands frequently. Cover your cough. Shelter at home. I've been hearing that people aren't taking this seriously. People are going to barbecues and going to other areas where they are exposing. I would also say that the studies are showing that if you control your underlying condition, if you have diabetes, get your hemoglobin A1C down. If you're hypertensive, make sure you're taking your medications. If you go to the doctor and the doc says, your blood pressure is 140 over 90, say, well, look, I need to get my blood pressure down. So be doubly focused on dealing with these underlying conditions that you may have. And then I'd say finally, really look at policy. Look at who's making policy around you. Look closely. There's a referendum in November. Take a look at those things. That's not right now, but that's 7 months from now.
A Frederick County woman's desire to help keep her community safe has inspired a pandemic co-op of sorts, as our Nancy Yamada reports.
It's a sight as beautiful as the spring blooms.
I have a couple of friends who are really excellent at mask making, churning them out, and they are kind enough to direct a couple to me each day, and I hang them on the tree.
They're free for the taking, hanging on the dogwood tree in front of Kara Sheehy's home in downtown Frederick. In fact, neighbors are welcome to anything on the well-stocked shelves of her front porch. Social distancing rules apply, masks required, and only one person at a time on the porch.
It's simple. Idea being, if you don't need to go to the store, if you just need one thing from the store, and you don't want to make a trip to the store for just the 1 or 2 or 3 things, it's here. Name something. Condoms, Band-Aids, pasta, soil.
What about yeast? I'm looking for yeast.
I am getting yeast delivered by Shelley at Rebel Shell Bakers tomorrow.
Sheehy's unofficial pandemic co-op has her neighbors dropping off and picking up items that are in short supply. Everything from produce to canned goods, spices to beans, and even snacks, puzzles, and books. If she doesn't have it, she'll post a request in her Facebook group, Frederick's TP Trading Post.
And whatever they want is here within hours.
Though some people donate money so Sheehy can buy in bulk, she tells everyone,
just take whatever they need and leave whatever they don't, and that's it.
The currency exchanged here is friendship, laughter, and communion.
It is amazing. I really think that, if more people were doing this, we would be keeping, infections down. We would be building community, and it's a whole new way of looking at what it might look like on the other side.
I mean, we don't have anything else right now. and we're all in this exactly the same, even though we don't all think we are. It's the perfect opportunity to live the exact life you want.
Clarity gained amidst challenging times. I'm Nancy Yamada for State Circle.
The coronavirus pandemic has impacted our plans to produce a debate in the Baltimore mayor's race. So instead, we'll be speaking to the candidates each week. Our Sue Copen caught up with TJ Smith.
We're joined by candidate TJ Smith. Welcome.
Thank you very much. Thank you all for being flexible.
Flexibility is the key here. Let me ask you right from the get-go. What makes you the best candidate in this race for the Democratic nomination for mayor?
I'm a non-politician who's well-rounded, who's seen things and really has worked in a really non-partisan way from a background of being a police commander, not really concerned about Democrat or Republican politics, really concerned about addressing the issues of the community. So I've gone out and learned a lot about, or a little bit about a lot of things. And I want to take all of my collective experiences into City Hall because I think people are just tired of the same old, the status quo, the political promises of what we're going to do. And then next thing you know, we continuously fall short because people have different aspirations of why they want to be in positions, whether it's a redemption show, whether it's because they want to have some status. I just want to do what's right for the citizens of Baltimore. Sadly enough, I've seen it up close and personal, of course, from my time with the Baltimore Police Department, reporting on literally thousands of murders, unfortunately, during my tenure, and also seeing, unfortunately, what happened to my younger brother during my tenure there. When you understand this epidemic that we've been going through in a different way, it makes you want to address it in a different way. But we know that it's much more than crime, it's opportunity, and it's gotten much more difficult now as we look at what we're dealing with this coronavirus impact and how we're going to emerge out of it. And it can't be politics as usual that gets us out of this.
All right, let me go back just a moment there, and let's go back to the problem with crime in the city, and you've spent your career in law enforcement. You say you have to think differently. What can you do that is so different? It has been, many things have been tried and the problems remain.
Yes, well, we have to be bold and we have to be unapologetic about what we do. What I've seen over the years is we're trying to be people pleasers and make sure everyone is happy instead of making decisions for the whole. And we have to actually be decisive about doing things. I haven't shied away from the fact that violent repeat offenders need to go to jail. And some of them might need mandatory sentences in order to correct their behavior, or at least be off of the streets for a period of time when we know that they're prone to the violence. We know that is who is committing the crime. I've been unapologetic with saying that we can't just look at arbitrarily reducing how we fund the police department just because it sounds good and we know we have to pay for other things. This city is one of the most violent cities in America. So we have to make sure we're holding the police department accountable, but we're also holding the people on the streets who are committing this crime accountable, and we can't shy away from that. I've seen a lot of shying away from that over the years, and we have to just really get focused on actually doing something about it. And it works both ways. We have to work across the aisle to get bills passed that protect the everyday common citizen from the violent predators that have really wreaked havoc over the last several years in Baltimore.
Let me focus into it. I mean, this is a huge problem. Now you've got a whole brand new problem with all of the issues that have basically come up in trying to fight the COVID-19 pandemic. The city is facing enormous challenges with that. How do you tackle that?
Well, first of all, I hope and pray that the current administration is already working on a task force, and that task force needs to be rolled out before we get over the hump. We should be working on a task force, and the business owners should be part of this as to how we're going to emerge. This is, we have the best hospital in the world. The world is getting their numbers, their everyday numbers from Johns Hopkins Hospital. We should be working hand in glove with them, along with business owners, educational leaders, and economists to work on our rollout plan of how we're going to emerge out of the crisis that we're in. That task force should be set up today, and we should be working today, whether it's Zoom conferences or what have you, as to how we're going to emerge. I look at things like this. We have a fire marshal who says 200 people in this facility is the max. Well, guess what? We need a coronavirus marshal now. How many people in this space is the safe amount to be here? And what distance do we need to keep these tables apart from one another where we can safely bring people into this restaurant? We can safely bring people into this business, because we have to get the economy going again to have people working. So we have to, again, use this opportunity to really refocus in on those areas that we know are the most detrimental in our city, which are the areas that have had the pre-existing conditions, which are our less fortunate communities. And we already know that. We knew it existed. We didn't need data to tell us that.
Last question for you. You win the primary. This is just a sort of a supposition here. And you win in the general election. What is the number one issue your first day when you take office?
Well, there are two at this point. Crime and emerging out of the coronavirus pandemic. That's bottom line. We have to do it, because if we look at what this coronavirus pandemic can cause, it's a loss of opportunity. And opportunity is what has driven the crime in Baltimore. The education piece is also the third tier of this, but the immediate things that we have to address are crime and the coronavirus emergence, to make sure people still have opportunity. Because if people don't have opportunity, they're going to turn to a life of crime, which is going to perpetuate the epidemic that we've had in the background of this pandemic for many, many years.
TJ Smith, thanks for joining us.
Thank you very much, and thank you all for being flexible. Be well.
For more of Mr. Smith's interview and all of our upcoming interviews, visit mpt.org/State Circle. We leave you with one of the many ways that Marylanders have been trying to say thank you to those who are putting their own lives at risk to help fight this pandemic, showing their appreciation this morning outside of Holy Cross Hospital. Be safe and have a good night.
This program was made by MPT to serve all of our diverse communities.
Programs on MPT are made possible by our members and the following.
Clarent, supporting our veterans to receive 5-star care in nursing facilities across the Mid-Atlantic. We've been improving healthcare quality since 1973 in the region and across the nation. Learn more at clarent.com.
Hello, I'm Robert Mushaw, Chief Investment Officer of Van Sant Mushaw, a fee-only wealth management firm acting as a fiduciary for families, trust, and qualified plans for over 27 years. Join us in supporting one of Maryland's most valuable assets, Maryland Public Television.
Hello, I'm Anirban Basu, CEO of Sage Policy Group. Our economic consultancy has served clients in more than 40 states and in 6 countries, but we're proudest to call Maryland home. Join us in support of one of Maryland's great treasures, MPT.
MPT and WTMD present a night of fan favorites with the Kelly Bell Band.